Good day. I'd like to welcome everyone to this, I think, the third or fourth installation of discussions in regard to medical marijuana. But today's subject specifically is going to be about CBD. I know it's very confusing out there, and a lot of my patients and a lot of people in the community have real concerns and questions about the use of CBD products. Let me first simplify this, and maybe we can get beyond the confusion. Right now, we have different products that is under the umbrella of marijuana. We like to use the term cannabis, and there's a long history, part of which is political, part of which is racial discrimination, that I don't like to use the term marijuana. For whatever reason, New York State felt that the New York State medical marijuana program should use the term marijuana. In Europe, it's called cannabis. Now, when we talk about marijuana or cannabis, we're really talking about three different substances, three different programs, three different forms of taking cannabis. Let me tell you about recreational, which is now being switched over to adult. Recreational marijuana, which is legal in about 11 states in the United States, New York State not being one of them, although you've heard about things changing in New York State in the near future, based on the recommendations of the governor. Recreational marijuana, or adult marijuana, is a THC product, which means, and I usually show this in front of my patients, that recreational is high THC, low CBD. So it is like a 40-to-1 and up to 80-to-1 ratio of THC to CBD. THC is the psychoactive effect of the plant, which, as you all know, is when people start ordering pizzas, when they get buzzed or high. Some people use it for nausea. Some people use it to weight gain. And some people use it for anxiety. That's the THC. We're not talking about THC in this discussion today. The other major component of the plant itself is CBD. CBD has medical effects. So recreational marijuana is high THC, low CBD. Medical marijuana brings the CBD up to this height. So it could be a 1-to-1 ratio. In medical marijuana has been approved in about, let me see, how many states is it? 34 states in the United States, and every year there'll be more and more states. In 34 states, medical marijuana, which has a higher CBD ratio. Now, in medical marijuana, which is legal in New York State, recreational is not yet, we as a physician can choose the ratio. It could be 20-to-1, 1-to-1, or 1-to-20, and that's the THC-CBD ratio. So the physician has control of the ratio of THC-CBD. So again, recreational, high THC, low CBD. Medical, 1-to-1 ratio, or 20-to-1 to 1-to-20. The third type, based on the 2018 Farm Act that was signed by President Trump, which really didn't get a lot of media exposure, but it was a huge thing for farmers. And it was quite important for individuals who felt that CBD in itself is helpful. So let's talk about CBD, which was really approved in 2018, December, Farm Act of the United States, or some people call it the hemp-based ruling, which approved the use of hemp-based CBD in all 50 states of this country. CBD has its own medical effects, and CBD helps patients with pain because it's a pain reliever. It helps people with inflammation. Let's give an example, arthritis, rheumatoid arthritis. It's an anti-inflammatory. It also helps individuals with anxiety, nervousness, and it helps you sleep. So I gave you four things. I gave you pain, inflammation, anxiety, and sleep. Now, there's a lot of other benefits. Most of that is scientific and hasn't been proven in human beings. But when I sit in front of the patient, I tell them that a CBD product could be help you in those four things. Now, CBD comes from the marijuana plant, but the marijuana plant naturally will give you higher THC with low CBD. The hemp plant will give you mostly CBD and less THC. In fact, in the United States, the Hemp Farm Act of 2018 stated that the THC has to be below 0.3%. 0.3% is the cutoff. If you have more than 0.3% THC, that is not a hemp-based CBD product. That is medical marijuana. So the government approved it, but unfortunately the regulatory bodies, knowing exactly what's in that vial, what's in that oil, hasn't caught up. And really, it's like the Wild West. You're not sure what you're getting. And that's part of the problems when it comes to hemp-based CBD products. You have to understand that in other countries, the THC component of a CBD product is different. For example, I was in Mexico City talking to their FDA. They asked me to consult with them, and their THC is 1%, which is higher than 0.3% in the United States. In Europe, on the other side of the pendulum, it's 0.2% in England and in other countries of Europe, while in Switzerland, it's 1%. So even in Europe, you have different ratios. But the bottom line is when you buy CBD, you buy a product coming from a hemp-based plant. And as you remember, hemp is used for ropes. Hundreds of years ago, it was used as paper for newspapers. It was used as sails for ships. And now it's being used in food and in clothes. So hemp agriculture is a multi-billion-dollar business that was just renewed because in the 1930s, it was made illegal, which is very unfortunate. And again, for political and racial reasons, and industrial reasons also. So a few weeks ago, we published on Facebook, would people ask questions about hemp? So I'm not talking about recreational marijuana. I'm not talking about medical marijuana. I'm talking about hemp-based CBD products. So at my institute, we have about close to 10,000 patients on medical marijuana and close to 3,000 patients who are receiving hemp-based CBD products. So some of the questions that were sent in are the following. So I'm going to read them off. And this is for the audience. And if somebody has a question, please be free to ask the question because I can see the question being typed up immediately in front of me. So first question, what does full spectrum mean? So about 15 years ago, a very well-known neurologist and botanist, his name is Ethan Russo, who I know personally. We've lectured together and we've been on panels together. He has written a lot about the basic science of CBD and THC. And let me just emphasize before we move on, CBD does not have psychoactive, it doesn't affect the CB1 receptors in the brain. So you don't get high, you don't get buzzed. But what does full spectrum CBD products mean? Full spectrum is the entourage effect. And many of you may have heard, what is the entourage effect? That's when the components of the plant are better than the individual components. When you add everything together, not just the CBD, but CBC, CBG, and there's about 118 different cannabinoids. Then you add another component of the plant called the terpenes. The terpenes are aromatic. You've heard of aromatic therapy, smell. That's what the terpene does. For example, the mango, the orange, the lavender, the other fruits, they get their smell not from the cannabinoids, but from the terpenes. So the terpenes have health benefits. We all know that. And nobody really talks about the medical marijuana or the cannabinoids, about the terpene content. The third is the flavonoids. So we got cannabinoids, terpenes, and flavonoids. So a full spectrum means that you have a little bit of everything. But if you use a CBD product, it's full spectrum, the THC has to be below 0.3%. Just remember that. Then there's a term called broad spectrum. So we talked about full spectrum. What does broad spectrum mean? No THC, period. Then there's an isolate. An isolate means that the compound, the tincture, the oil, has 99% pure CBD and nothing else. No THC, no terpenes or flavonoids. Now, an isolate CBD product made by GW Pharmaceuticals out of England was approved by the FDA for the treatment of a rare epilepsy disorder called Dravet's or Lennox-Gastaut. You may have heard that in the media. Well, that's a pure isolate of CBD that was studied by the FDA in multiple trials, and it was approved for only those reasons. Unfortunately, that's a pharmaceutical product that you have to have a physician, probably a neurologist or epileptologist, write this out for you, and it costs, unfortunately, $30-some thousand per year. So it's not cheap. And that's called Epidiolex, if you want to read about that. But again, we're talking about FDA approved, although not regulated, CBD products that are over the counter and do not contain high dosages of THC. It has to be low, as you remember, 0.3%. So the real question is full spectrum more effective than CBD isolate? We don't know. Most people, especially who are harvesting it, growing it in Colorado and in California, believe that the entourage effect, full spectrum, is better than isolate. But scientifically, I can't tell you that. What I can tell you that both products, CBD products, full spectrum and isolate, are very safe. So another question is, and I'll read them as we're going, is CBD marijuana? That's an interesting question. The answer is yes. It comes from the cannabis sativa plant, but it is grown in a way where the THC has to be very low. Now, people always ask me, well, is this sativa, indica? Is it ruderalis? The answer is those plants we don't see anymore because most plants are hybrids. They're being cross-fertilized and to give high THC, high CBD. So the term that we use is chemovars. Chemovar type 1 is when the THC is very high and the CBD is very low. Chemovar type 2 is when the THC CBD is like 1-to-1 ratio, so about equal. Chemovar type 3 is when the CBD is high and the THC is very low. So what we talk about today is really a chemovar type 3, which is part of the the marijuana plant, the cannabis sativa or indica, but it has a high CBD and low THC. The most famous one being Charlotte's Web, produced by the Stanley brothers in Colorado, who have been here in my office. We have discussed their product. So they do have a very well-known product called Charlotte's Web, which you can get on the internet, although there's a significant expense related to that, probably because they're known as the Bentley of cannabis products. But there's no proof that the other products don't have similar effects because there's no science comparing A to B. So another question from Irene. Irene asks, will CBD get me high? Well, the answer is no, unless you go on a plane with it, and then you'll be up in the air, and that's high, and that's a neurological joke nobody laughs at. But CBD won't get you buzzed or high because it's not psychoactive, and it doesn't affect the CB1 receptors in the brain. So it won't get you high. You could drive with CBD, you could work with CBD, and it would not get you buzzed or high. Or and in many ways, CBD will help your psychological profile by helping anxiety and depression. Um, is CBD safe? As we know it, look, medical marijuana has been around 12,000 years. I just looked at some statistics. If you're a smoker, I recommend you quit smoking. About 500,000 people die of smoking. Now that smoking has decreased from 40% of the population to less than 20% of the population, lung cancer has decreased close to 30%. So quitting smoking is something that is compatible with a longer life, unequivocally. Alcohol. 73,000 people die of alcohol-related diseases in this country, and alcohol is legal, and alcohol is on TV every day. Watch the NFL games. All you saw was beer commercials and alcohol commercials. And 73,000 people die of that disease, not to mention what it does to families, how it destroys relationships. So that's a legal drug. Marijuana hasn't killed anybody. And you say, no, I've heard of people. Well, marijuana directly has not caused a death in this country or any country, because to die from marijuana, you have to smoke about 10,000 cigarettes in 15 minutes. I'd like to see you try that. It's not going to happen. So marijuana is safe. Now, if I take the THC out of the marijuana and just give you CBD, that safety record is even better. So CBD is safe. Now, in the patients I've seen in my clinic, we have not seen, the only complaints we've seen with CBD is taste. Some people just don't like the taste of it, but we've not seen any interactions with other drugs. I recently wrote an article with Dr. Django from the DENT about the use of CBD products with anticoagulants like Coumadin, aspirin, Plavix. So we do a lot of research, but we have not seen any liver problems, kidney problems, heart problems, or neurological problems with the use of CBD products. So I have a question here from Bharat. Will a broad spectrum CBD product help with skeletal muscle spasticity associated with MS? Good question. As you know, there are medications in Canada and Europe that were approved for the treatment of spasticity related to multiple sclerosis. That's called Sativex. It's not approved in the United States, but we do give a lot of THC, CBD, medical marijuana for patients. So the THC is what was found to help spasticity. So we don't have that much literature looking at pure CBD in spasticity. Spasticity means stiffness in the arms and legs related to multiple sclerosis. But we feel that CBD will help a lot of the symptoms of MS, the anxiety, pain control, sleep control. So all I would tell you that if you can't get THC, CBD together in the medical marijuana program, and by the way, you should be able to because it's indicated in New York State, do try a CBD product for MS and see how you feel. If you feel better but not great, then add the THC and talk it over with your MS specialist, who I know should be knowledgeable in medical marijuana. So that was a good question. Another question, is CBD FDA regulated? Well, it's approved by the FDA, but it's not really regulated. And that's one of the problems. And let me get into that problem. There are multiple studies, which I can quote you, looking at the content of CBD products on the internet and in stores. One specific study done by a Dutch researcher looked at 43 products that he took off the internet and checked it. He looked at the label. The label said CBD product. Then tested the product for THC, CBD, and contaminants. As you know, the marijuana plant, the hemp plant, pulls everything out of the soil. It's like a filtering system. It's one of those plants. So when they looked at the study, those 43 cases, about 20% of the products had no CBD in it at all. 80% were mislabeled, meaning if they said 10 milligrams of CBD, it was most likely 2 milligrams. And close to 20-25% of patients had higher THC levels than what's accepted by FDA regulations, which is 0.3%. So that kind of scared everybody because once more, the FDA approved it, but it's not regulated. The only time that we see the FDA interfere is when a product says, buy my product because it cures cancer. Well, guess what? You can't say that. And you should not say that. If somebody ever tells you CBD cures cancer, if CBD does something that is outrageous, then there's making statements that the FDA will come down on. I'm very fearful of charlatans out there saying things that are just not medically proven. Now, we can discuss how CBD does things in cancer patients, even patients that I treat with brain cancer. As you may know, I'm a neurologist, but I'm also an oncologist working at a Roswell Park. So there are scientific and basic science and lab animal studies that show that THC and CBD may be beneficial, but I can't tell a patient that take this CBD and I'm going to cure your cancer. If anyone says that, run. So CBD is regulated, but is not regulated, and you have to be fearful what's in it. The other side of the coin is about 80% of these products have pesticides, insecticides, heavy metal, and even fungus. That's scary. So you have to be sure when you buy a product, either on the internet or at Wegmans or anywhere, that you be sure it is third-party tested. What does that mean, third-party tested? That an independent, emphasizing independent, lab looks at the content of the CBD product, possibly looking how much CBD is in it, how much terpenes are in it, and if it says 10 milligrams per ml, then it better be 10 milligrams per ml. That's called third-party testing. The other part of it, they test also for contaminants, test for pesticides, insecticides. I've said this in the past. I have never lost a patient from the use of medical marijuana or CBD products. I've lost one patient who used a bong, 26-year-old, who used a bong and came in with a lung infection, which we biopsied. It turned out to be a fungus from the bong, from the recreational marijuana. So if you use recreational marijuana, if you use medical marijuana, if you use cannabis, be sure that you have third-party tested to rule out contaminants. Very important. And that's what's scary, because right now, when you buy something, you can look at the product, and on that product is a QR code. Let me see if I can find well, I don't know if I have a QR code. I don't have any samples here, but a QR code should be on the sample. You look it up on your iPhone, and it gives you the third-party testing, and you can review it. If it's legit, you'll have third-party testing. Question from Robin. How does CBD oil work for fibromyalgia? Now, fibromyalgia, as many of you know, is a chronic pain syndrome of musculoskeletal pain that occurs above and below the diaphragm. It could be very disabling. Unfortunately, a lot of our patients are on opioids because of that. And we have been using CBD products for the treatment of fibromyalgia. And let me tell you, the patients we treat, a little bit over 3,000 patients, as they come back, about 80% of them say their quality of life is improved. I'm talking about an over-the-counter CBD product that helps multiple things in one's life: the anxiety, the sleep, the pain, the inflammation. So do I think CBD works for fibromyalgia? I would definitely try it. I would definitely try it, and this is maybe the time I'll talk about dosing patients. Just like medical marijuana, the saying is start low and go slow. What does that mean? So I like the dose of 10 milligrams of CBD 3 times a day, but I will start off only at night. Start off at 10 milligrams at night. If you're somebody older, you may want to start off at 5 milligrams, but 10 milligrams at night. And after a week, increase it to twice a day. And after another week, increase it to 10 milligrams 3 times a day for a total of 30 milligrams. One would think that that is high dose. That isn't. CBD isolate Epidiolex was used 1,000 milligrams for the treatment of epilepsy. So we're not treating epilepsy with CBD. What we are doing is giving patients better quality of life with musculoskeletal pain. So my recommendation to Robin is start for fibromyalgia 10 milligrams at night and increase that accordingly to 10 3 times a day. If you're having still issues, be sure that you be seen by somebody who has an expertise in cannabis or even CBD products. So that is a good question, and I think I would recommend you try it. If it doesn't work, then you may need some THC. That means you need to be part of the medical marijuana program, which in New York State is legal for fibromyalgia under the umbrella of chronic pain. Another question from Christine. Would this be a good option if I have daily tension migraine headaches? Should I bring it up with a doctor at the DENT? The answer is yes. All the doctors at the DENT and nurse practitioners know how to give medical marijuana, especially in the headache center. We actually are publishing an article looking at chronic migraine and the use of medical marijuana. And I have to tell you, the results are really rather remarkable. So I do feel that in migraines and chronic migraines, a CBD product in itself to use at nights, 10 milligrams. Now, in New York State, we don't use CBD products via a vape. That is not legal in this state. And as you know, nationally, the use of vapes is controversial because there's been over 25 cases of death and over 1,200 patients admitted to hospital with lung disease. So you got to watch out with the vape. Now, I will say that New York State program for vaping with medical marijuana is relatively safe because it's third-party tested, and we've not had any issues. Most of the issues with vapes have come from illegal companies and back in the garage put together substances and that has caused pulmonary disease. Most people feel that it may be related to abnormal vitamin E that was being put into these vapes. So to answer your question, yes, talk to your doctor, try a CBD product, see if it improves your quality of care. Also, the DENT Headache Center, which is one of the premier headache centers in the United States, do see new patients. So we'd be happy to see you in the headache center or a cannabis clinic. We have a separate cannabis clinic and headache center. Questions. So there are so many different products. How do I know which one is right for me? Well, good luck. You don't. But what I will tell you is that there are reputable companies in this country who sell cannabis or CBD products over the counter that are third-party tested and quality controlled. I mentioned one company, which is Charlotte's Web, which has a huge reputation. There is an expense to that. In Buffalo, if you're from Western New York, we are working with a company that a few years ago we contracted with called NIRA, N-I-R-A. The company, in fact, is called Jushi, but the product line is NIRA, N-I-R-A. And at the DENT Institute, within the tower of Harlem and Sheridan, we have a Nira store. I have to be very careful because I'm here talking about cannabis and medical marijuana and CBD as a researcher. So we have to be independent and not influenced by outside companies. But I will say that NIRA is something that we formulated here at the DENT that we test routinely, third-party testing, for the amount in the product that it's appropriate and contaminants. So I can say that the NIRA product is another product that is safe and well tested and physician formulated. I will say that I can name other companies that I feel relatively comfortable with on the internet, mostly stationed out of Colorado. But you just have to, wherever you get your product, either at a chiropractic store or office or a store somewhere in West India, don't be surprised that if you switched over to a NIRA product, you see the difference. So, number one, third-party testing, check it out. And if they say it is, let them prove it to you. Let them show you a piece of paper showing the third-party testing. So the NIRA brand, we do research with. We're actually publishing articles on how we use the CBD product. So we're very comfortable in our institute. But that doesn't mean that the product that you're taking is not bad. It may be good. Statistically, 20% chance of that, which is still better than nothing. All right, let's see what other questions. Many people, including my doctors, have suggested I take CBD, but I'm scared of the side effects. I hope that discussion will put you at ease that this is an over-the-counter product. It's not regulated well by the CBD. So if you get a good product, it is safe. It doesn't affect your driving, doesn't affect the work. But here's a question that's always asked by patients. Well, I work for the VA. I work for the university, which is state, federal grants. The bottom line is, what if they do a urine test on me? Am I going to be positive? The answer is, we don't know. The likelihood that you get THC positive, again, this is a CBD product that you bought over the counter. The likelihood that you will be positive THC in a urine test is extremely low. Let me also tell you that companies now are not checking for marijuana in the urine because people know that it's legal in this state, and maybe in 4 months' time from now, it may be legal recreationally. So why check for a legal product? So companies are not checking for cannabis or marijuana as often they used to be. Getting back to CBD products. If you take a lot of CBD products, over-the-counter CBD, a lot of it, or high dosages of it, you possibly could be positive for THC in your urine. So you have to watch out. So the answer is you most likely not, but possibly yes. And most people then get fearful that you'll lose your job. So if you're outpatient, obviously, as your patient advocate, somebody who does feel that this works, I would obviously contact your employer and have a major discussion. Say, look, I gave to CBD. This is a legitimate use, and let's have a discussion. I've done that with the University of Buffalo when somebody was tested positive in the past. So far, I have not seen. Now, we will be doing a study looking for individuals who are taking CBD products and checking their urine for THC and CBD. I think it's important for us to look at that and publish those results, and that's my plan in the next few months. So let me see. There's another question from Laura. Please define what CBD helps and what THC helps, and why THC isn't always necessary. Okay, so when you smoke it, you get THC. If anyone's had an edible on THC, in low doses, it helps anxiety. In high dosages, it makes anxiety worse, and you get paranoid delusions. That's the edibles that kick in late. So THC helps spasticity, helps pain, increases appetite, and helps nausea. CBD, anti-inflammatory, pain reliever, anxiety reliever, helps you sleep. They're the four major. There's other things. For example, it's antibacterial. It helps acne. It helps, in theory, basic science, it helps kill cells that are dividing, cancer, but no proof in human beings. It helps protect the brain from trauma, from dementia, from Alzheimer's. Not proven, but in theory, it's a neuroprotective agent. So if you have memory issues, if you if you had 8 concussions, and you fear chronic traumatic encephalopathy, so-called CTE, then it may be a consideration. Question from Evie: will you ever sell THC in your clinic? The answer is right now no, and it's a simple reason. The New York State marijuana program said if you're in the business of marijuana, you can't be in the medical education treatment. They separate the two. So I cannot be part of these, what we call these stores, dispensaries. I have no business interest in those dispensaries. The CBD product downstairs from Jushi, I have been asked to be the medical director for that. But I don't get money from selling those products. I believe in the products, and I think the products are very good, but that's a separate business. From Trudy: I have a chronic anxiety and dealing with the breast cancer. How can I get help from the cannabis clinic? I currently go to the DENT. So if you go to the DENT and you have breast cancer anxiety, all you have to do is ask to come to the cannabis clinic, and we'll be happy to see you. I mean, we see 110 cannabis patients every day in our clinic. So we see a lot of patients. And by the way, your symptoms related to the breast cancer of anxiety, I call that like a PTSD related to your cancer. I think CBD would be very helpful for you. So just talk it over to your DENT physician or nurse practitioner, and we'll be happy to see you here. I think we have a very well organized clinic. We see a ton of patients, and I think we've helped a lot of people. I say this often. When I started in cannabis, which is slowly 5 years ago, I was not an advocate. I was a skeptic. What changed me is my audience, my patients. That's what's changed my perspective to an advocate, because I cannot deny the results I see as a physician. And so we won't turn anybody away from the cannabis clinic. We do regulate, we do follow you every 2 to 3 months. So just remember that. Now, from Jennifer: what do you think of the ketamine infusions for PTS and depression? Well, that's an interesting question. Somewhat off subject, but by coincidence, look, the DENT Institute, which is the foremost neuroscience center in the United States, we always think out of the box. We've done things here that nobody in the country has done. Outpatient electroconvulsive therapy, or ECT. We are very unique. So we did start a ketamine clinic a few weeks ago. It's already been very successful. I use ketamine for the treatment of intractable pain and headaches, but ketamine is being used for the treatment of severe depression, not responding to medications. So what I would recommend, talk it over to your psychiatrist or your pain specialist. And our ketamine clinic is outpatient. And again, contact the Institute, ask for the ketamine clinic, and they'll be able to help you. But while you mentioned ketamine, which is a different topic, I will mention that a lot of people ask me about CBD and interactions with medications. So when the CBD is very high, 1,000 to 2,000 milligrams, yeah, there could be interactions with some of the new epilepsy medications. But we don't see that with low dose CBD. So I would tell you that CBD is extremely helpful and should not interact with your medications. We have not seen that, but every doctor will tell you if you try something new over the counter, CBD, talk it over to with your physician. Be sure that your physician is on board. Okay, too many people take nutraceuticals and spend a lot of money that's wasteful and potentially harmful. Just talk it over with your physician. Hey, I'm using this. Is it okay? Um, so so who can use CBD? So THC should not be used in children unless there's a specific indication, but in general should not be used in teenagers. Smoking marijuana should not be used in teenagers because the brain is evolving, and there's some science that's shown that THC may decrease your IQ by 10 points and may also affect the growth of your brain. There's not enough information on CBD. So in theory, CBD can be used by children. I would be cautious. It should be a good indication and not just as a supplement. CBD has no problems over the age of 21. In pregnancy, we don't use THC. And right now, I'm going to say we shouldn't use CBD because there's just not enough information. CBD in lactation, breastfeeding, not enough information. I personally would stay away from CBD in lactation and pregnancy and children. But CBD is fine for people with heart disease, kidney disease. Just be sure that your primary doctor is knowledgeable enough. So I think the time is 11:42. Let me see if there's any further questions. Oh, I just got one from May. Are you at Dr. McVick fighting to get autism and Tourette's added to eligibility list for medical marijuana? Good question. So one of my colleagues in the headache center, a pediatric neurologist who's a headache specialist that deals with autism and is a crusader for her patients, is Dr. Jennifer McVig, really an outstanding physician. And we have been talking to New York State Albany and Marijuana Committee about adding autism to the list for medical marijuana. CBD products, not an issue. So you could use CBD, but what you're looking for is a combination of THC, CBD. Now, there are several states in this country, last I saw, about 5 or 6, that have approved autism as a indication for certification for medical marijuana, Georgia being one of them. I think it could help autistic patients. Dr. McVig will tell you, and she has given this lecture, and I have given this lecture about the use in autism. I think there is a benefit to it, but you got to pick and choose your patients, and you really should be under the supervision of somebody such as Dr. McVig and Dr. Mohammed Kwasaime. So I would. There are 2 pediatric neurologists at the DENT. So the answer is we are advocating, but there's ways to give medical marijuana to autistic patients if they have anxiety, post-traumatic stress disorder, which is an indication, who are in pain. So even in New York State, we are still giving patients with medical marijuana. My recommendations is to start a CBD product first and see how your child does. So let me see if there's any other question. So I'm being told that that's it. That's it? I'm enjoying myself. Can I go a little bit longer? Okay, no, I can't. So this is if there's an interest, we'd be happy to take on these subjects. As you can tell, we've been doing a tremendous research with medical marijuana. We have a full research team here. Still looking for more cases and more science and more publications. You know, we are fighting a battle because the establishment is not on our side, and I'll leave it at that. But But it's a battle worth fighting for our patients because all the years I practiced medicine in cancer patients and neurological disorders, I have never seen the results with such a substance that's natural and with minimal amount of side effects that we've seen. So I'm very encouraged. I don't think you need to fear this. I think you need to embrace it. And if you try it and you don't see the results, then come to a cannabis clinic and see if we could address it and adjust the dosages. If you're not sure, the one thing I should mention, that our patients get a significant discount within the NERA store on the first floor at the DENT Tower. That discount is probably 1/4 or 1/5 the price of a lot of other products out there. So if the quality is good, you could pay a high price, but if you're my patient, you get it, or our patient, you get a significant discount in that store. And I'm only saying that because I'm doing research right now about medical marijuana, and believe it or not, 60% of patients cannot afford it. You heard it, 60%. And I've reviewed 1,200 patients and received feedback. And when you have 60% of your patients who, by the way, say, this really helps me, but then says, I can't afford it. Some patients in the medical marijuana program are starting off at 120 and paying not $500, but $1,300 a month. That's just not affordable. So over-the-counter CBD product that's third-party tested with prices in the $30 range, if you find that place, go for it. Thank you very much for that discussion. It was really honor and pleasure informing the audience and my patients. So if you have any questions, please be free to send us a text. And then depending on the interest, we will continue these discussions going forward. Again, thank you very much from my colleagues, my individuals who put this together, and my patients who deserve the best care that they can get. Thank you.